So Will, thank you very much for having me here. I'm Kip Wenger. I'm an emergency medicine doctor, but I'm a medical director at Cornerstone of Recovery. You know, working 2 weeks after Thanksgiving, this sweet little lady comes in, short of breath, hypoxic, meaning her oxygen level's low. She has been doing a great job, according to her husband, of staying isolated until Thanksgiving. She couldn't wait to see her kids and her family couldn't wait to see them. They all came in, a big group, 25 people. One of them was asymptomatic, and she got it, and she died. That's tragic. That's real, man. You can't make this stuff up, and people don't see that. And I don't know that we're supposed to talk about that, but that's the reality that I live in, and that's why I feel so strongly about this. It's a big deal. If you would have asked me, a year ago, and we talked about this, what's the likelihood of a vaccine being available in a year? And it being this effective, I would have said no chance and no chance. The irony, and I think frankly the tragedy, is we have this vaccine, but the hard part should have been the development. What we're finding is the logistics of distributing this has been much more difficult than we expected, and that's what we're facing right now, and that's why we're talking. I'm old, but I'm on social media. I think, social media has been amazing as a purveyor of information, but it has also been amazing as a purveyor of misinformation. And there is a lot of misinformation about this vaccine. So I would strongly encourage, as you make a decision, I'm not going to sit here and scorn you for saying, you know what, for whatever reason, I don't feel comfortable taking the vaccine. That's your choice. But I would make an informed decision based on a review of reputable data. And to me, the reputable data are things like the CDC website. There's great information out there. I think one way to look at how a vaccine works is, vaccine is a very sneaky biological trick. We trick your immune system into reacting to a virus without giving you the virus. We give you a little piece of it, a little taste of it, but enough of it to basically kind of supercharge your immune system. So when and if you do get exposed to the virus, your immune system is ready to go and is able to minimize any of the effects of the virus. There are some side effects associated with having the vaccination. So your immune system, when it kicks in to fight this little piece of the virus that isn't the entire virus, when your immune system kicks in, it kicks in with the symptoms that you can think of, like a little bit of fever, a little bit of fatigue, a little bit of headache for some. That's a good thing. That's an immune response. And that's exactly what you want when it comes to getting a vaccination. That's a very common question, is why are there multiple shots that go with the vaccine? Well, the reality is that we just don't realize or remember that when we were kids, we got 2 MMR shots. The tetanus shot gets a booster every 5 years. The flu shot, really, we get a new flu shot every year as the flu mutates. So it's more common than not to have multi-vaccinations to go. This COVID-19 vaccine was studied, and in the 2 vaccines that are out there, the Pfizer and the Moderna, it was clear that while you get a pretty good response, 50%, with 1 shot, if you get that second shot, it gets up to 95-96%. So that is a huge improvement, and that's why the recommendation is to get 2 shots. If you were in charge of marketing, you might, in retrospect of the vaccine, you might think twice before calling it Operation Warp Speed, because it has put a little bit of fear in people that corners were cut to get there. I'm here to tell you, as a medical professional, as someone who's had my 2 vaccinations, that all the components of getting that safety and efficacy tested for the vaccine have been completed. What happened with Operation Warp Speed that was really unprecedented is the federal government basically said to the drug companies, look, we're going to give you money and go for it. We'll buy it. So the risk to put out a product was gone for them. So they could make multiple different products and then test them. Normally what happens is that process takes place over a period of years. Now, what we really care about as end users, as potential customers, if you will, of the vaccine, is the stuff safe and does it work? So that's what's called phase 3 in a vaccine trial. So the phase 3 vaccine trial for this vaccine, for COVID-19, is no different than any other vaccine. What's different is that front part that was basically altered by the federal government's willingness to say, hey, pharmaceutical industry, you have no financial risk, because this is a multi-billion-dollar project. That's a huge deal. So I have no qualms about it coming out so quickly. I'm just thrilled that it's here. Do the mutations that we're hearing about now change our approach to the vaccine? The short answer is no. What do we know at this point today? We know right now that at least when it comes to the viral mutation in the UK, that in point of fact, the Pfizer vaccine does still work for that. What we also know for sure is that viruses are constantly mutating. That's what they do. And most of them are inconsequential. They don't change the danger, virulence would be our word for the disease. This mutation is problematic because it changes the transmission. It's more easily transmitted. Doesn't make it more dangerous, but what it does do, if more people are getting it, it will overwhelm healthcare systems. And that's a big issue, right? The other piece of that is this idea that the more mutations that are allowed to occur, the more danger that we are in of getting a mutation that is particularly dangerous. Now, we haven't gotten there yet, and I would knock on something if you wouldn't yell at me for whacking the microphone out. But I think it's really, really important that we get people up to speed in a vaccination kind of way so we can get through this thing. I will tell you right now in healthcare, in our local area, in Eastern Tennessee, if you were to come into the emergency department with a heart attack, your access to care is not the same as it was a year ago. I am not proud to look you in the eye and tell you that's the case, but that's the case because beds are limited in incredibly short supply. Resources are limited. So what will come back as we get more and more people vaccinated and realize at this point we've only got a couple percent of America vaccinated at this point. But as we jump that vaccination rate up to 30% or greater, we're going to see healthcare return to normal. So you're going to get better health for, God forbid, you have a stroke or a heart attack or those kind of things. We're going to have people safer, going about. There's going to be less spread. I'll look you in the eye and tell you it's not going to be immediate that you get a vaccination and all of a sudden the world is right and as it was. But it's a step in the right direction. And if enough of us choose to put our arm, roll up our sleeve, and get the vaccination, I have absolutely no doubt that we'll reach that level of population, 30, 40, 50% that have been vaccinated, where all of a sudden borders start opening up. You can leave the country. You can go to a restaurant. You can get together with your family. And I think how fast that opens up will be a function of how much infection is out there. The more COVID vaccinations that take place, I have no doubt the better off we're going to be.